is a non-for-profit organisation. We're a community of all healthcare professionals, and we aim to provide a lot of networking and social opportunities for healthcare professionals, as well as mentorship and guidance for careers, and we do a lot of outreach work as well. If any of you have any specific questions about the House of Medics or you want to get involved, just let us know. You can drop us an email or you can drop me a DM on any of my social media platforms. And this Careers Close-Up is something that we've started. It's going to be a monthly webinar with different healthcare professionals, just to basically give people an insight into what it's like to work within that profession, and also tips for those who want to get into it. Now, I know that dermatology is really competitive, and many of you will be thinking about how you can maximize your chances and make your application attractive for dermatology. So the majority of this talk is about, getting your portfolio together. But I will start with talking a bit about me and my journey and how I've got to where I am so far. This is very informal. If you have a burning question, you can unmute and just ask it. Otherwise, do ask questions at the end. And lastly, we are also streaming on YouTube. So if anyone is, I don't know, maybe you're watching at home, you'd rather put it on the TV, or if you want to share the link with people that you know, you can send them directly to our YouTube channel. We're House of Medics on YouTube, and this is streaming live on YouTube. So let's get started. Okay, so first of all, this is the plan. I'm going to talk through the journey up until now, spend a bit of time talking about the application form, what it's like to be a dermatology registrar, and I'm specifically focusing on being a derm reg because as a consultant, your timetable is really, really different. You have a lot more autonomy over what you do within your week, and I can mention that briefly, but I'm going to focus on what it's like to be a dermatology registrar because that's a bit more uniform, and that's probably what a lot of you want to know. And then just end with some useful tips as well. So the journey so far, this is just, I put this picture in just to remind me to tell you guys that I'm one of those people that I've always known I wanted to be a doctor, but I haven't always known that I wanted to be a dermatologist. And I think some people feel like you need to know right from the beginning in order to make your application attractive, but that's not the case. I actually decided I wanted to go into dermatology when I had already finished medical school. I was an F2. When I left medical school, I thought I wanted to be a GP, but then I realized that I'm very much a specialist. I'm not very good at I'm not a generalist just because, I like to know what I know and I wanted to have a niche. And that's how I ended up in dermatology. Sorry, just my slides are stuck. Next slide. So I went to Imperial. I started Imperial in 2009, and then obviously I did, years 1, 2, and 3 as normal, and then I did an intercalated BSc. At Imperial, it is mandatory, and I decided that I didn't want to do a bog standard clinical BSc. I did mine in management, and honestly, I felt like it was the best decision. Really enjoyed that course, and I think it gave me a lot of skills that I still use today. Controversial, I think, intercalated BScs are now because, yes, they give you a lot of experience and they give you some new skills, but most of the high specialty applications don't give you points for having an intercalated BSc anymore. And it is an extra year, which means an extra year of student loans or money to pay back. So have a think about whether that's something that you want to do or not. I graduated in 2015, and again I included this picture to remind you that you don't need to do something really academic with your elective. I did very minimal work with my medical elective. At Imperial, the electives are after finals when you've already passed, so you can actually just really chill out. And I think that electives are a really great opportunity to offload, go on holiday with your friends. So I don't think that everyone needs to be super productive in their elective. If you have the passion to, then by all means do so. But I think a lot of people assume that, did you go to America and do lots of projects in your elective? I went to Trinidad. My elective was in obstetrics and gynecology. I think we went in for a total of about 4 days. And the rest of the time we were at the beach and doing things that we wanted to do. So yeah, don't feel like you have to do a really academic elective to get into dermatology. Like I said, graduated in 2015, then did F1 and F2 in what used to be called South Thames. So I did my F1 at Frimley Park and I did care of the elderly, this weird hybrid job that was A&E for 3 days and then liaison psychiatry for 2 days. Then I did orthopedics, and then for F2 I went to St. George's, and that's where I did a dermatology rotation, and I absolutely loved it, and that's when I decided that I wanted to go into dermatology. Then I did A&E and general surgery. Following there, I took an F3 year, which I highly recommend. And in my F3 year, I became a teaching fellow. I went back to Imperial to do that. And again, that was a really good decision for me. I was able to do a PG cert within that year. I'm very passionate about teaching and mentorship anyway, so I love just being able to teach for a whole year. And also, one of the good things about my teaching fellow job is it didn't have any medical on calls. So when the students finished in like April, May, like I was basically chilling until August. So again, that's another plus to that Imperial teaching fellow job if any of you are interested. And then I went on to do CMT. I was the last of the CMTs. Of course, it's now called IMT. I did CMT1 at Guy's in St. Thomas's Hospital, doing oncology, cardiology, and intensive care. And then I went back to St. George's for CT2, doing care of the elderly rehab / derm. Again, it was a weird hybrid job where you did dermatology for 1 day a week and then care of the elderly rehab and like a community hospital for the other days, gastroenterology. And then I was meant to do, what was I meant to do? I was meant to do acute medicine, but it was COVID. So they basically said that we shouldn't rotate. Everyone should just stay where they are. So I ended up doing an extended gastroenterology job with just medicine, acute med on calls whenever was needed. And then 2020, I started dermatology. And at this point, I usually have this QR code just for you guys to put up some comments about why you want to do dermatology. It'd be really good if we can spend 5 minutes doing that because it will help me tailor the talk. Also, if any of you feel brave enough to just unmute and shout at me why you want to do dermatology, that would also be nice. But yeah, if you can just take 5 minutes, I need to scan the QR code as well so that I can see your responses. And I'll give you just a couple of minutes to do that. How's mine not working? Okay, so someone said, oh, you got lots of comments. Someone said, a specialist can see diagnosis from inspecting, visible improvement to people's lives. Someone said, I'm passionate about making people feel comfortable and confident in their own skin. Underrepresentation of dermatological conditions in black and brown skin, absolutely. Improved treatment for skin of colour, definitely. These answers are coming in fast. I noticed there was a huge gap in dermatology care for ethnic minorities as a lot of people were not familiar with how derm conditions look on darker skin, so I'm passionate about changing this, definitely. Balance between work-life balance, yet surgical aspects and treating cancer, especially for skin of colour. Everyone is so interested in skin of colour. This really warms my heart because obviously this is something that I'm very passionate about as well. Okay. And you guys can also have a read at different ones. But I guess a lot of people interested in skin of colour, some people interested in work-life balance as well. Okay, good to know. So now I'm going to go into some more specific things. Just going to start with some disclaimers. These are my personal views only. If you speak to different dermatology regists or consultants, you'll get different views. Also remember that things change all the time and remember that all departments are different. So let's talk about the application. Here are some competition ratios. This is all readily available information on the Physician High Specialty Recruitment website. You can see that the competition does vary from year on year. It seems to be that there'll be a lot of numbers one year. So when I applied in 2020, there were a lot more numbers. And then the numbers go down and then they realize, oh, we don't have any registrars. So then they put the numbers back up. So you can kind of see a bit of variation with the competition ratios. And it's also important to note that it varies from region to region. So for example, between 2020 and 2024, there were very few numbers in London. And then all of a sudden for the 2024 intake, there were lots of numbers in London. So even though these competition ratios talk about the national competition ratios, it's different for different areas. These are literally screenshots from the Physician High Specialty Recruitment website. Go and have a look at those. It is really frustrating because they keep changing this. So like I mentioned earlier, before you could get points for having an integrated BSc, now they've taken it out. Before you could get points for leadership and management, now they've taken that out. But it is still worth keeping a close eye on these tables because if, you know, what else are you going to go by? This is all we have. And it will allow you to tailor your portfolio, because the sooner you start working on your portfolio, the better. It's really important to remember that not everything that you will score for has to be related to dermatology. And it's also important to remember that you don't need multiple things within one section. So if you've already got a couple of publications, I wouldn't spend loads more time trying to get more publications. I would, you know, focus on maybe getting some teaching experience or some presentations in, stuff like that. So have a look at these. I will just run through them quickly. So this one's about your, if anyone's done any additional undergraduate degrees, you know, if you have a PhD, it's a bit far away. Is that what it says? Yeah, if you have an undergrad degree before you start medicine, that's great. But a lot of us don't, and you can't really go back and change that. This one, the commitment to specialty. Everyone should be getting 10 points in this. If you're not going to get 10 points in this, then to be honest, there's not really any point applying to become a dermatology reg. And it's quite easy to get the 10 points. You need to just attend a few dermatology conferences, attend things like this, do a quality improvement project in dermatology, just a few things to show that you are serious about being a dermatologist, and it's quite easy to get the 10 points. Next slide. MRCP UK, again, a tricky one, but really do try to make sure that you pass all three parts of the MRCP before you apply. If you decide to take an F3 year or an F4, definitely try and put some of the exams in there. So I did MRCP part 1 and 2 in my F3 year, so that I was able to do PACES in CT1, and then by the time I was doing my application, I had already passed all 3 parts. And because the difference in the number of points you get for having done all 3 parts is significant, because it's so competitive, sometimes it's, you know, 0.5 or 0.25 of a point that differentiates you from getting a point or not. So really try and get your MRCP in as soon as possible. Even if you're doing your F2 and you have some more chill specialties, like maybe during your GP rotation, or if you have some sort of community rotation, see if you can get MRCP part 1 done. Just try and get it done as soon as possible. Sorry, someone's changing my slides. There you go. Presentations, again, be strategic. So if you can do an oral presentation, and you've got that ticked, you don't need to run around trying to do 10 million presentations. Also try and think about international presentations. For example, conferences like the EADV, they are very keen on accepting pretty much anything for a poster presentation. And you don't even have to attend because it's virtual. So I submitted something to the EADV. Sorry, that stands for the European Academy of Dermatology and Venereology. I submitted something there when I was in F2. I didn't even attend the conference. And then on my portfolio, all of a sudden I have an international presentation, and it looked very impressive. So look for opportunities like that. For those of you who are interested in Skin of Colour, there's also the Skin of Colour update, which happens in New York every September. There is the UK, we had our Skin of Colour conference in the UK in January. Things like that, they're often really keen to get more presentations because they're a bit more niche. Not everyone is thinking about presenting at those things. So it's quite easy to get abstracts accepted. Publications, when I applied, I had one publication and it was from my BSc year, and that was it. I think for whatever reason, I find that a lot of students and resident doctors are really hung up on publications. Publications are fantastic if you can get them, but they are a lot of work. At the moment, I'm still working on publishing my registrar project, which I literally started in 2021, just with all the back and forth and all the revisions. Sometimes people are paying for publications. I just think that sometimes that energy can be channeled into things that are easier, for example, quality improvement projects or presentations. So if you have a passion for research, absolutely pursue that passion, get your publications in, but don't kill yourself for publications if it's not something that you find easy to do. Teaching experience, I think that those of us as doctors, we need to choose something from teaching, management, research. I always say that you should aim to have at least one of those as your main thing, and if you're lucky, 2. So mine was teaching and leadership and management. Now it's annoying that leadership and management has been removed from the scoring grid, but who knows, it could always be added back in. But definitely choose one of those 3 So for me, mine was teaching experience. So if you do end up doing a teaching fellow job, or even if you don't do a teaching fellow job, if you're interested in teaching, consider doing a PG cert. I think almost everybody has them now, so it is actually it's quite difficult to get in without one. And I think that's a bit unfortunate, because obviously if you don't have a passion for teaching, it's annoying to spend all this money and time doing a PG cert. But I think it's just becoming so competitive that everyone is doing everything they can. So do think about doing a PG cert if you can. I don't think it makes you a better teacher. I think it's a bit of a tick box exercise, but what can we do? It is what it is. We have to play the game. I should have said that for this slide. For the slide before, make sure that you organise a teaching thing. That is so easy. Everyone should be getting full marks in that section. Organise some sort of teaching programme. It could be dermatology if you want. It can be something else. Just make sure you do it over 3 months. Make sure you get feedback. Make sure that it's documented somewhere, what your role in it was, that you organised it. Get some of your consultants or your supervisors to, verify that, and just, do some teaching, because those are easy points. Quality improvement, again, they've made this more difficult. When I was applying, it just had to be that you've done a quality improvement project and you've presented it somewhere. But now they're very specific about you having done the 2 cycles, and you have to demonstrate the role that you played. So again, make sure that you're ticking all those boxes. You can't just say I did a quality improvement project. You need proof of what your role in that project was, where did you present it, and we will look for it. So make sure that you have all of that and you have all the evidence gathered. So you're going to put that portfolio together. So when I did it, it was a physical portfolio that you create, but now obviously you upload all your documents to the online system. And then what happens is some volunteer consultants, so people like me, will volunteer to grade your portfolio. So you will put your portfolio in and you will say, I think I deserve 6 points in this section because I've published 2 papers. I think I deserve 5 points in this section because I have a PG cert, etc. And then it's the reviewing consultant's job to go through and verify that you've scored yourself correctly. And they will mark you down if the evidence isn't there. You don't get an opportunity to have a conversation, or they won't ask you, what role did you play? If it's not there, you just get marked down. So you need to be really, really, like I was saying, you need to make sure you've got all the evidence and it's laid out very clearly. Like literally, if you've got a letter of recommendation, highlight the bit that you want them to see. Just make it very clear, because it's just normal people like me, normal consultants who are volunteering to do this on a day off of work. So make it very clear, make it very easy in your portfolio exactly why you think you deserve that number of points. So you're going to upload all of that. And then if you've done well enough, you'll be invited to interview. And the interview, I haven't gone into that today because that's a whole nother kettle of fish. But if you have questions about the interview, let me know. And then if you're offered a job, we then rank the jobs. And then most people start in August, but we also have the round 2, which is in February. There will be conditions to you being able to actually start as a registrar, meaning that you have to obviously complete IMT and complete all the IMT competencies, even though you're not going to have to do any of those things again. So I remember that I hadn't done a chest drain, and it was a big issue that I needed to do a chest drain. In the end, I got away with it because of COVID. And we basically blamed COVID that I didn't get my full training opportunities because of COVID. But in general, you have to tick all those boxes, even though, why would I need to know how to do a chest drain as a derm reg? But it's really important that you do all of those things, because there are people who have been denied from starting their registrar post because they haven't filled all their competencies. And then obviously MRCP has to be passed before you begin. And this is just a general timetable. This was my timetable in ST4 when I was working as a derm reg in a district general hospital. And I thought this would probably be the best one to show you because it's very general. It's a mixture of general clinic, 2-week wait, ward rounds, pediatrics clinics. But on the right, there are so many other different clinics. I did 3 years of my training at St. George's, which is a busy teaching hospital. And there I had a lot more specialist clinics. So complex surgery, I could shadow Mohs, I did melanoma clinic, patch testing, genetics clinic, all these different things. And depending on where you train, your level of exposure to those sort of specialist services will be different. Even if you don't get to train somewhere that has those things, you still need to demonstrate that you have seen it before you can finish your reg training and become a consultant. So for example, I didn't work anywhere that does laser. So on some of my days off, I had to go to another clinic to observe laser, things like that. You will do on-calls. On-calls are different everywhere you work, but you'll do a mixture of inpatient during the day on-calls and also out-of-hours on-calls. Some people have you on-call overnight. Some people have you resident on the weekends. Some places you can do it from home. It's different everywhere you are. In my region, we used to do on-call once a week until 10 p.m. and that could be non-resident, so from home from 5 to 10 p.m. and then your weekends were non-resident from 9 to 10 p.m. Some places will do resident where you have to be in the hospital from 9 to 1 and then non-resident afterwards. It's just different everywhere. In dermatology, we have a lot of educational meetings and opportunities for research, which is nice. In London, every Thursday afternoon is off for all registrars. So you can't be, so you're not going to have any clinics on a Thursday afternoon so that you can attend teaching. And you do a lot of admin. Being an outpatient specialty, there's a lot of admin because in a day, if you have two clinics, you can see 24 patients and then you have to chase all their blood tests, all their biopsy results, all of their different, all the different things that they require. You have to go through the letters that you've written. So there's a lot of admin involved in these outpatient specialties. And just a few myths that you'll hear. You will hear people saying things like, "Ooh, derma holiday, it's so easy, you don't do any work." And that's not true. The state of the NHS means that there is absolutely nobody who is chilling. If you work in the NHS, it's going to be tough regardless of whether you work in A&E or you work in psychiatry. It's not chilling. But of course, I cannot complain when I've got, friends who are doing obstetrics and gynecology, still doing night shifts on call every other weekend. Of course it does have a better work-life balance than a lot of specialties. But in general, don't let people tell you that it's not hard work, because it is. Other things is that you don't get taught anything about skincare and like cosmetic procedures, Botox, when you do study dermatology in the UK. In America you do, but in the UK you don't. So if you think you want to become a dermatologist because you like skincare, don't bother. It's got nothing to do with skincare. I know a lot about skincare because I've done my own extra reading, and I think it's important to teach patients about, how to take care of their skin and things that they can do for themselves. But it's not something that is really part of your day-to-day work. It does come up in the exam. You have to learn a little bit for the exam, but you're not going to learn, all these things about all these new aesthetic procedures and how to give Botox as a derm reg. That needs to be done in your own time. A lot of people think that you need a PhD to become a derm consultant. You don't. I don't have a PhD. And a lot of people think that you need to be a med reg in order to become a derm consultant, and you don't. Dermatology has its own separate on-calls. If we were doing medical reg on-calls, then who's going to do our derm reg on-calls? And it keeps coming up every few years. Everyone's like, "Oh, I heard they're going to change it so that you have to do med reg on-calls." And it's like, well, no, because who's going to do our on-calls? So as far as I'm aware, there are no plans to put derm regs on the med reg rota, which is absolutely fantastic because I wouldn't have done it if I had to do med reg. So yeah, you can put your mind at ease from that point of view. I think in terms of pros and cons, I would choose dermatology any day as a specialty. I am very, very happy with my choice. I love the variety. I love that I see adults, I see children. Even though I don't do pediatric dermatology anymore. I love that I get to do some surgery. I do medicine. I do cosmetic things. It's just so varied and I absolutely love it. Night shift just did not agree with me. I always knew that I couldn't do something that involved, general medicine on calls. And I quite like that it's outpatient based, actually. I quite like seeing patients who are, well enough to walk into the clinic. We can have a conversation. I think outpatient clinics are really intense because you're literally seeing a new person every 15 minutes and you have to make a lot of quick decisions and do a lot of admin. It can be super intense, but I do quite like outpatient specialties. I really hated ward rounds when I was a junior, so I'm happy I don't have to do too much of those now, even though I do kind of. Derm is kind of relaxed in the sense that we don't have any pressing emergencies. Our dermatology emergencies, even the Stephen Johnson syndrome, it's not something you have to run towards. I knew I could never do something like obstetrics and gynecology where it goes from 0 to 100. It's just not my personality. It's just going to get me too stressed. So I quite like that, even our emergencies are relatively chill. I don't like all of it. I don't feed off of that adrenaline rush that a lot of people do. It just doesn't suit my personality. And of course, you do get lots of free skincare, for sure. I'm not going to hide that for a second. I put the fact there's outpatient base on both sides. Some people will not like the outpatient style, and that's fine. Again, it depends on your personality. I think in dermatology, we get a lot of very poor referrals that can be really frustrating, both from inpatient work and from GPs that are being referred to clinic. People just think it's okay to say, well, I don't know how to describe the rash. I don't know much about dermatology, but, you can't say to a cardiologist, oh, I can't describe the chest pain, or I haven't done the ECG, but people always think they can do that in dermatology, which I think is quite frustrating at times. I think we're often misunderstood. People think that we're just sitting around putting sun cream on all day. People think all we do is throw topical steroids at things. But dermatology is really complex. It has 2,000 diagnoses. A lot of them you don't learn about in med school. So once you start as a registrar, you're doing a lot of new learning. It can be quite intense, and I think some people don't appreciate that, and sometimes that can be frustrating. And I definitely think some people are just jealous that they didn't decide to go into dermatology, and it's fine. You chose your specialty, I've chosen mine, so don't let people put you off with little comments that they make. I hear all the time from my mentees that when they tell, maybe let's say they're on their renal rotation or they're on their surgery rotation, and they tell their consultants they want to be dermatologists, they can be like looked down upon, or say things like, oh, what a waste. But some of the most intelligent doctors I know are dermatologists, so please don't let people put you down if this is what you want to go into. And then last couple of slides, remember, like I said at the beginning, derm is really competitive and the jobs are rare. But if you really want to do it, you will get a job eventually. If you feel like you're in a rush and you want to get a job the first time you apply, then it may be that this isn't the specialty for you. But as long as you're willing to stick at it, try a couple of times, you don't mind, going back and reworking, adding to your portfolio, you will get a job eventually. So hang in there. Be strategic, like I mentioned. Always remember that you don't need to max out all the points in like all the different. What I'm trying to say is don't spend lots of time working to get more things in a section when you've already maxed out the points. And that's what I'm trying to say there. Make sure you sign up to the British Association of Dermatology. I think it's virtually free if you're a student. And there's lots of opportunities there about events you can attend and things you can get involved in. Also sign up to the RSM because they do monthly dermatology meetings. Find a friendly dermatologist if you can, who can get you involved in projects and publications if possible, and actually know what a dermatologist does. It's not about giving people Botox and like massages and stuff. Actually ask questions, and hopefully you've got a bit more of an insight from joining this call, joining this Teams meeting. And yeah, I hope that's been helpful. Here are our socials, and I'm happy to take any questions. So you can either put them in the chat or you can unmute and shout them out. So I think, I'll probably have to join on my phone actually so that I can see the chat. Can you just admit me? Okay, with an event like this, would we put this down on our portfolio to prove enthusiasm? Are we able to? Okay, so first question, yes. So you'll receive a certificate that you attended, so you can add that yes, you've attended a webinar on getting into dermatology. Are we able to do the teaching component in med school? Yes. So that's the other thing. Anything that you can score anything in your portfolio that's done from the start of medical school onwards. So you can't really score for things done in school and college, but you can start from medical school onwards. And actually, I would advise that you try and do as much in med school as you can, because once you start working, it's just difficult because obviously you're working all the time, you're really busy. And I feel like as a med student, there are lots of opportunities. You've got all your societies and things to get involved in. So definitely you can start the teaching from there. And how would you encourage to keep track of everything we do for our CV? Yeah, good question. So just gather the evidence, buy a big ring binder, and anytime you do something, print it off, put it in there, make a folder on your computer, scan everything, put it in there. Just be really organized from the beginning, color code it, highlight things, just gather everything. Whether you're a physical person, you want it in a ring binder, or if you want to do it on your computer, whichever, but just gather evidence as soon as possible. Someone said, how is your work-life balance like now as a consultant compared to as a reg? So I still work 5 days a week, but I work 2 days privately and then like 2.5 days in the NHS. So work-life balance is so much better. I just feel like I have more control. What's interesting is when in my NHS day, I'll do 12 patients per clinic, 24 patients in a day. But in my private clinic, I'll see, for example, I was at my private clinic today and I saw 9 patients across the day. So just working privately, you just have so much brain space. You feel like patients actually get a much nicer, they get a better deal because they actually have time to discuss with you. And also your head hurts much less because you just haven't had to make so many decisions. Like making decisions for 24 patients is quite a lot. So now that I only do a few days NHS, I find my NHS days so intense, and I wondered how I was doing it full time before. The other good thing about my private days is if I need to take leave, I can just say, oh, I'm not coming to my clinic tomorrow, and they'll just have to cancel all the patients. Whereas in the NHS, you need to give 6 weeks notice. So I think those are the main things. Like I'm still working all week, but I've just got a lot more autonomy, and I'm doing things that I just got a bit more time for things that I like. Obviously, I'm not doing any on-calls. Some places where you work, consultants do on-calls as well. But where I work, we only do inpatient, like in hours on calls from 9 to 5. We don't do any out of hours on calls, which is nice. Someone said, there's not much opportunity to get experience with derm in med school. Gosh, questions are coming so fast, sorry. There's not much opportunity to get experience with derm in med school. What would you suggest a student does to get more exposure to the specialty? Yeah, so you have to be really proactive. So literally just find out where the derm clinics are happening and just go there and say, hi, my name's Emma, I'm a medical student. Please, can I sit in your clinic? Don't say, hi, I'm a med student. Do you have any projects for me to do? Because we don't have projects like coming out of our ears like that. You need to sit in the corner in the clinic, listen, be observant, be helpful. So for example, when the patient leaves, help the doctor wipe the bed. That kind of stuff is just so valuable because the clinics are so busy. Little things that you do to help just shows your willingness. And then as you're in the clinic, it might be that there's an interesting patient and then the doctor will say, oh, why don't you write up this case for publication, that sort of thing. So you definitely just have to be present. You're going to have to use some of your spare time to just go to clinics. And from there, you will be introduced to the team. And once your team knows that you're keen, a lot more opportunities will come your way. Great overview. Thank you so much. You're welcome. Will this be recorded? So yeah, it's on YouTube, so you should be able to watch it back. And I would like to send this an IMT in my hostel, and will you do a talk for derm interview? I can if you want to. I can, yep. Someone said, thank you, Dr. Emma. In your experience, are there any particular regions that are good for dermatology training? Good question. So I trained in London and I think it was really great. I think there's lots of opportunities in London. From what I understand, a lot of my colleagues in like the Midlands seem to be having a really good time. They said their consultants are really supportive. What else have I heard? To be honest, I think the teaching in general is good everywhere, and every area has their different like nuances and problems. For example, where I was working at St. George's, we were doing like more on calls than most people, and we're seeing 12 patients in clinic, whereas I've heard that in other places they only see 6 patients per clinic. So there's this joke about if you train in George's, you're like you're a consultant from day one. So every area is a bit different, but in general, I think derm training in the UK is really good. I think that the BAD have a good understanding of what is needed, and yeah, I think pretty much if you get in anywhere, you'll probably have a good time. What are your thoughts around CSER? Is it difficult to achieve? Do you know people who have gone about this? Is it mainly through trust grade positions in dermatology? Would it be possible, e.g. through GP posts? Okay, so CSER, for those who don't know, is an alternative pathway to become a consultant if you don't get your standard registrar number. Yes, I do know people who have done CSER. I think is a great option. You can't do it in GP posts. You have to be working within a dermatology role, and most people do that through clinical fellow or trust grade posts. I think CSER is great because you get to stay in the same place for 4 years, which is nice. You don't have to move around. You get to know the team. And in the vast majority of places, the CSER trainees are treated exactly the same as the traditional derm trainees. So you're going to get, you're still going to get all your teaching and all your opportunities. The only thing about CSER is you have to be so organized. So I've seen some of my colleagues pulling their hair out, trying to get all their evidence together. You have to prove, oh, I've seen a patient with eczema, I've treated a BCC, I've done this. You have to be very, very meticulous. So if you're not someone who's very organized, then you might struggle. But otherwise, it's a good option because obviously derm numbers are so few and far between. For the portfolio, is it a rigid form you fill in on Oracle, or is it document you make in chronological order? It's a form you fill on, it's not called Oracle, is it? What's it called? I forgot the name of it. Oriel. It's a form you fill in on Oriel, and then you upload the evidence to prove what you need. Other than societies, how do you show commitment to specialty whilst in med school? How do you show this once working as well? You attend events, so you attend things like this. You go to the BAD conferences, you go to the RSM conferences, you just attend lots of events. You do some of your projects in dermatology. Not all of them have to be in dermatology, but if you can, you attend derm clinics and you write reflections on things that you've seen, all that kind of stuff. Also, those of us who still like the acuity of gen medicine but not the hours, but also love derm, is there a way we can combine both at reg level, or do we have to decide what is more important to us? I know this is probably not a realistic question. You won't want to do gen med on calls once you're a derm reg, I promise. It's busy enough as it is. You will do dermatology on calls, which has aspects of general medicine. Anyway, you'll see, you still have to have a medicine hat on when you see these patients. Trust me, that'll be enough. I don't think you'll miss general medicine on calls. Where can we find the points criteria? Is there a website that has all the up-to-date points? Yeah, it's the Physician High Specialty Recruitment website. So go on Google, type in Physician High Specialty Recruitment, go to the dermatology section, and it's all there. Someone said, thank you, Dr. Marful, for the talk. It was truly inspiring. You're welcome. My name is Fawzia. I'm a committee member of the ACMS at KCL. I was wondering if you'd be interested in giving a talk. Send me an email, babes. This is a one-to-one discussion. Okay, and I think this will be the last question. Did you consider moving abroad, as you mentioned places like the US allow you to do more cosmetic stuff? I am considering moving abroad. Every day I consider moving abroad because the NHS is tough and I don't like being cold. I don't think I could go to the US. Personal preference, I think America's a scary place. I think practicing medicine in America is scary just because I think just the way we're taught medicine in the UK, it would be really weird to me to, just the whole insurance thing and having to basically, convince insurers to pay for certain things. But to be honest, now that I started working privately, I have to do a bit of that anyway. And that's actually quite a big culture shift when you start working privately and you realize your patient is paying for every investigation. And sometimes that they've gathered all the money they have just to see you, but then you can't even treat them because they can't afford the treatment, all that kind of stuff. So I suppose that as I'm being exposed to that, it may be that with time, the prospect of work in the US is less scary. So, but just for now, I don't think that I would want to work in the UK. I think if someone said I needed to move right now, I could go to the Middle East and probably practice quite comfortably. But yeah, definitely. And of course, Africa will end up doing something there in the future. If you know me, that's where my passion is. Thank you. Where can I find your email? You can message the House of Medics account via our website and it'll be passed on to me. Any tips for revising for MRCP paces while working full time? No, it's just a really horrible time. Like there's no sugarcoating it. Like it's just not easy. You just have to kind of use your evenings, your weekends. Remember that you can take study leave for revision as well. So don't forget that. It's different in every hospital, but there will be some sort of policy about how much study leave you can take before your exam. But yeah, it's just tough. I don't think there's I'm not going to pretend like, oh, it's fine. It's really tough. It's a hard time, especially PACES. I was really, really depressed when I was studying for PACES, but you make it through and then you can laugh about it a few years later. What are your dermatology consultant truthful opinions about GPs with extended roles? I think they're amazing. I think we need a lot more of them because we can't see everything in secondary care. So I think good GPs with extended roles are really, really helpful, very progressive. We need to be pushing a lot more of the care for our patients into the primary care sector. So the more specialists we have in primary care is beneficial for all of us, for doctors and patients. So yeah, I think if some of you feel like you have personalities that would lend well to being GPs, but you still have that dermatology interest, then definitely I think a GP with an extended role is a nice option. And sometimes I've actually worked with GPs with extended roles who have become so specialist that they can actually come to hospital and run dermatology clinics like once a week. They'll come and do a clinic with us. Yeah, and they're really experienced. Even when I was a reg, like I learned a lot of my surgical skills from a GP with an extended role. So yeah, I think they're definitely assets, and a good option for people who want to go down that route for sure. From YouTube, what is the CTF job? Was the CTF job hard to find? Was being an Imperial alumni helpful? No, they didn't care that I was an Imperial alumnus. It wasn't hard to find. So if I remember correctly, jobs for clinical teaching fellow posts come out in around February. And actually, that job, so the Imperial job is now super popular. It wasn't actually a dermatology teaching fellow job until I did it. So you guys have me to thank. So when I did it, I was the medical teaching fellow. But because I had an interest in dermatology, I basically volunteered to do some extra derm teaching. And then what happened was at the time we had a rheumatology teaching fellow. And they were moving rheumatology from the 5th year curriculum to the 6th year curriculum. So that basically meant there was going to be a year where no one was learning rheumatology, if that makes sense, because then the current 5th years were going to wait and get their rheumatology training in 6th year. So they were going to lose that rheumatology job. And then I was like, well, no, make it a dermatology teaching fellow job. So that's why Imperial now has a dermatology teaching fellow job. And it's really, really popular. If you can get it, I think it's a great opportunity. But you basically just keep an eye out for NHS jobs, and you have to demonstrate that you have a passion for teaching, that you've done some teaching before. It's probably a lot more competitive now than when I did it, but definitely worth a try. Otherwise, there are lots of other teaching fellow jobs, which are really great as well. Have you considered Australia in terms of working abroad? As lots of NHS doctors are going there now. Is there many opportunities? Yeah, I haven't considered Australia because I can't deal with the bugs. They have like bugs and alligators and snakes in Australia, so it's not for me. But definitely lots of people are going there, and it sounds like they've got really nice work-life balance. And Australia has amazing dermatology. A lot of the world-renowned famous dermatologists who have done lots of research and stuff are from Australia. And obviously their skin cancer rates are so high because they have, a white population in a very sunny area. So it's a great place to learn dermatology. I also have friends that have gone, to Australia for a year to do a fellowship just because there's so much that you can learn there and then come back. So yeah, Australia would be a great place to go, just not for me. Okay, I think I'm going to wrap up. I blitzed through all those questions. I am always happy to answer emails or anything. So feel free to contact me via the House of Medics page or via any of my social media platforms. Next month, we'll be doing Careers Close Up in obstetrics and gynecology. So please share with any friends who you think are interested in that. Keep up to date with everything House of Medics is up to. Do get involved if you'd like to. We have lots of volunteering opportunities and lots of events coming up. And thank you all so much for joining. Thank you all. Thank you, thank you. Thank you, whoever that was. Thank you, guys. Why you stop it?